Well, thank you so much, Louise, for taking time out of your schedule. It is always a pleasure to spend time with you. As I have said many, many times on my show, I look up to you and consider you
Oh,
as a mentor and, watching you has been very inspiring.
oh,
And
thank you.
so I wanted to talk to you today, sort of about this holistic approach to menopause. I think both you and I are similar in that we talk about HRT a lot on social media because we believe that's where the most myths and misconceptions are. But there is so much to, this decision, this discussion. And so I think it behooves us to kind of talk about what other holistic approaches or lifestyles are really good, either in addition to HRT or, with or without. And so, talk to me a little bit about what you have been incorporating, seeing in your clinic, doing yourself, and just how to kick off a healthy transition through menopause.
Oh, it's great questions, and thanks for inviting me, Heather. It's really wonderful to be on your podcast. So, I think when we think about menopause, we have to think about what it means because that's really important because there's so much noise. And actually, I was using AI to produce I did it as a test, really. I said to AI, produce me a presentation about the symptoms of the menopause. And it
Oh
was
boy.
lovely. Visually, it was beautiful. But you know what it had? It had hot flushes, it had sweats, it did have low mood, and it had vaginal dryness. That was the fourth one. And then the whole presentation was about those four symptoms.
Mm-hmm.
Now, I every day in my clinic, we see people who have lots of symptoms, including those four, but we see lots of others as well. So we have to think about the myriad of symptoms, and we can, I'm not going to argue with you, but we could argue about whether there are 36 or 136 or 258 symptoms. There are loads of symptoms, and every day I learn more and more symptoms from patients.
Uh-huh. Uh-huh.
So we've got that, and we have to remember why they have symptoms, and it's due to the hormonal changes that occur. The three main hormones, obviously, estradiol, progesterone, testosterone, they
Yeah.
change, they fluctuate. It's different for
Yeah.
different women. We're all different and we're individuals. That's the most important thing, I think, when we talk about menopause is individualized care. But then we have to think about without these hormones, which is what happens when we're menopausal, which will last until the day we die, our hormone levels are low. And so these hormones are very anti-inflammatory in our body. When they're low, we have more inflammatory diseases, and they're the very common diseases, as you know, heart disease, cardiovascular disease, osteoporosis, type 2 diabetes, dementia, clinical depression is even an inflammatory disease, non-alcoholic fatty liver disease is an inflammatory disease, autoimmune diseases, even Parkinson's is an inflammatory disease. We know it's just fact that women, when they're menopausal, have a higher risk of these diseases. So then, as clinicians, we need to think, how can we help these women? What are the best treatment options? Yes, we've got hormones that replace, but also a lot of these inflammatory diseases are diseases of aging as well. So we need to really invest in our patients as well as ourselves. You know, I'm a menopausal woman myself, to try
Perry over
and,
here.
yeah, so to try and reduce our risk of diseases. And I'm very interested in longevity. I'm really interested in living well and keeping well. It's not the age I die, it's the journey to that age. And that's the same for my patients. We talk about health span, not lifespan.
Yeah.
So then we think, right, for this individual in front of me, and this is where individualize is important, what is the best thing for this woman? So we can talk about hormones or not, but what else is important? Well, this woman might be drinking alcohol, she might be smoking, she might be catching a bus to work and never exercising, she might be overweight, or she might be taking 28 different supplements a day. She has no idea what they're doing to her and be super
Yeah.
fit, amazing, but really highly strung and never doing any meditation or many mindfulness. So there's lots of myriad of possibilities, but what we need to do is work out for that individual what's best. And so we're looking at when I say exercise, I hesitate because I prefer sort of movement really.
Movement. I
Because
know.
if I said
Yep.
to every patient, right, you need to do the couch to 5K or you need to run a marathon, I can't run for toffee. Like, why would I want to run? But actually, I really enjoy yoga. I really enjoy doing some weights. I really enjoy gardening. So let me do more of that. That's fine. So
Yep.
work out individually your movement, your exercise that's going to work for you.
Yeah.
Most of us can improve our diets, and it's really important to look at what we're not just eating but drinking. So I was talking to my daughter this morning about all these drinks that you can get that are caffeinated. So I'm not
Mm-hmm.
going to mention any brands, but so many of the coffee shops, it's not just
Mm-hmm.
coffee anymore. You add these like caramel shots and you add cream and you add all this. Like, why? Why do we need all this? It doesn't make, I mean, I don't drink coffee, so I've never had any of this stuff, but it just looks ridiculous. It's all chemicals. And all this
Mm-hmm.
zero, whatever, calorie drinks, they are
Yeah.
chemicals.
Yeah.
So we need to think about what chemicals are we putting in our body that our body won't recognize, that will increase inflammation. So we
Mm-hmm.
all need to be looking at that really importantly. We need
Mm-hmm.
to be looking about our mental health,
Mm-hmm.
because most of us at some time our mental health will change. And we need to look about our sleep. Sleep is so important for so many reasons.
Yeah.
So looking at all of those are
Mm-hmm.
crucial, but I feel really strongly, and I'm sure you do too, that we shouldn't be saying everybody should be doing X, Y, Z. And actually,
Yeah.
how I exercise now is quite different to 10 years ago, and it might be quite different in 10 years' time. What I ate and my metabolism was different 10 years ago than it is now. So we need to be constantly assessing and reviewing and working out what's right for us,
Mm-hmm.
because I feel very strongly if we do that in an empowered way, that we're deciding as individuals what's best for us, we can have a really positive menopause, because there's so much out there saying
Yeah.
how terrible the menopause is, and untreated menopause, where women aren't being listened to, where women are denied choices, where women aren't looked at as an individual, can be a really lonely place. So all these things together can amplify our future health, which is so important.
Mm-hmm. I I couldn't agree more, and I can't help but being a little biased and thinking about how the way that women have to reproduce or may choose to reproduce,
Mm,
and having children and what motherhood means. Not to say it's harder for women, but you've probably heard the story of as soon as I had my first baby, my sleep was never the same again.
mm,
And as soon as, and then you've got your little kids in the house, if you are blessed to have children, and you've got cold fish all over the house, and you've got graham crackers, and you've got all this processed food, and you're trying to take care of your family and raise good humans, and it's really difficult to exercise too. I'm in that phase of life. And I actually am one of those women that loves to exercise. I remember being like 28 and I was like, there'll never be a day when I don't exercise. um, and it's interesting for women, if we are primary caregivers and because we are the ones to reproduce, because we are hardwired to hear the babies crying in the middle of the night. And we just can kind of easily fall into some of these patterns. And I don't know how you talk to your patients about this, but sometimes by the time they get to peri or menopause, it's a really good time to be like, all right, what's been happening for the last 2 decades? How kind of have we derailed? And what steps can we do to bring back good steps? So I'd love to ask you because, how do you get people or talk to people who are in really bad habit spirals or have been there for a long time to change habits, whether it's sleep or diet or movement? Where do you even begin when they're like, "Oh, Louise,
yeah.
I'm taking care of my parents now and my kids and, this, that, the other thing."
It's really hard, right, isn't it? And I
Freaking
think
hard.
there are a couple of things that I've learnt with life. One is to be really selfish. I know that sounds really awful,
Oh no, I am the
but
most. My friends always
you've
tell me I'm so
it's
selfish.
the whole
Gotta
oxygen,
put
isn't it? In an
yourself
airplane,
first.
you put yourself on first. So,
Yeah.
if your diary is really busy, diarise when you're going to exercise. If you can't like have time because you come in and you're hungry, just prepare your food in advance. Most meals will last 2 or 3 days, and I sometimes eat the same for 2 or 3 days. It's not the end of the world because I don't eat the same every day. So, and so I think that's important. But that's that whole thing that you've got to do it at the right time for you. And
Yeah.
that's important. So this sounds just so idyllic, but I'm going to tell you anyway. At the weekend, my children were at home and I was doing yoga with my two children, my older two who are 21 and 19. And I was like, this is amazing. Like we did, it was such a great practice. We had such a lovely time. Now that sounds wonderful, but hear me out, because in the middle of lockdown, I was still doing yoga. I was saying to my children, who were then 3 or 4 years younger, can we do some yoga? Will you just shut up, mummy? Why would I do yoga? And like they just would never do anything and wouldn't exercise at all. And now my middle daughter, who used to be really fit, and then she got sepsis of her sacroiliac joint and was really poorly, and everything just
Oh,
was difficult after that. But
yeah.
she's now discovered Pilates and she's doing some yoga, and her fitness, because she was quite gymnastic before, is all coming back to her. And
Oh,
obviously her confidence is coming back too, which is wonderful. But I
yeah.
haven't pushed her into it. She's watched me do it. She's very
Wow.
jealous that I can do headstands, and she could nearly do a headstand. But I have allowed her to be able to do it in her own time. And now I know next time I see her, she will be able to do a freestanding headstand, and it will really wind me up.
Yeah.
But we've made it fun, but I haven't been lecturing her. And I think as a clinician, it's so easy to look at someone and go, oh my goodness me, what you're telling me, you don't exercise at all, that's awful. But I was taught very early on never to judge a patient. And
Yeah.
so sometimes I've said to a patient, what I always do when I first meet them, do you do any exercise? And if they say no, I don't push it.
Yeah.
Because sometimes when they come back 3 months later, they say, do you know what, Dr. Newson, you asking me that one question made me feel so bad that I've dug my trainers out from the garage. I walk in the park every day, and
Yeah.
they've done it themselves.
Yeah.
And I
Yeah.
just think that is really important, because it's so easy to go, what do
Hmm.
you mean you haven't got time for exercise? What do you mean? And then they'll feel so inadequate. And I don't want my patients to feel inadequate. I
It
want a
pushes them
nice long-term
away.
relationship.
Yeah.
And
Hmm.
yeah, and so it's sort of, my teenagers have taught me a lot over the years, that it has
Oh,
to be done in on their terms, in their time, and what's right for them. And
yeah.
that's similar. I'm not saying my patients are like teenagers, but it's that mutual respect, you
Exactly.
know, and I think that's really important, because it's also, you want lifelong habits. And then I guess the other thing that I think with food is add in things rather than take away. Because if I
I
said to
love that.
you, you're not allowed chocolate, every day you think about chocolate,
Chocolate.
Whereas, like, I don't eat chocolate because it will trigger a migraine. So I'm lucky and not lucky having migraines. So it really dictates what I eat. I can't have any snacks because I will just get migraines.
Mhm.
But actually, I do want to say to people, oh, look at me. I don't do fizzy drinks. I don't do caffeine. I don't do alcohol. I don't smoke. Like, no one wants to listen to someone like that. They all know they should be eating better. But actually, rather than that, say, next time you're hungry, if you want your chocolate, fine, but have a handful of nuts beforehand. Have a big glass of water until you reach for your diet, whatever drink.
Yeah.
And then you're sort of changing in a positive way. Do you know what I
Yeah.
mean? Because it's really hard in life, and everyone feels negative at times. So you want to feel good about yourself. So at the
Yeah.
end of the day, if you've eaten exactly the same, but you've also had something good, eventually you'll be cutting back on the less good stuff,
Yeah.
because your body
Yeah.
knows what's good for you. It just takes a bit of time to change.
And I think those are so actionable if you're either a clinician listening or um it, as a woman listening, because it, it definitely can become really hard. And I
Mm,
think one of the things that I'm trying to cultivate now, because I'm sort of in the middle where I got a couple good days and a couple bad days and a couple good days and a couple bad days, but is mindfulness, so that
mm,
um it's so easy to say, it's maybe so cliche to say, like being mindful. For me, that comes across as like journaling or meditating, which I think very much is part of yoga as well as mindfulness practice, as well as good for your body. But the mindfulness practice is something that I tried to incorporate. I probably never did in my 30s, really started in my 40s. And I'm hoping that that's going to help to ground me and guide me as I continue to go through and more challenges continue to present themselves and habits either start to change or form more firmly. And that's kind of how I do that. I journal and I like to listen to guided meditations. What about you? Do you like any of those? Do you recommend any of those?
Yeah, it's interesting. So years ago, it must be when I was just qualifying as a GP, so 2000, mindfulness just started,
Yeah.
and it was a new term. And so I
Yeah.
remember buying a book, and you could go on a course about mindfulness, and I was really confused what it was. And it's a bit like meditation as well. I was like, how do you do it? What do you do? You spend so long thinking about it, worrying about it, reading about it. You don't actually do it yourself. And I did a podcast a while ago with someone called Claudia Brown, who's a yoga teacher, but she's also very into mindfulness. And she said, Louise, when you're in your shower, why don't you just really enjoy the smell of your shower gel or your soap and
Mhm.
just have a bit of mindful
Mhm.
time then, enjoy what I was like, what? Oh, okay. And it's sort of I think and I'm very mindful actually. I have a
Yeah.
very active brain
Yeah.
and
Yeah.
it's often telling me really bad things about how inadequate I am and how not I'm good enough and I need to do more. So it's not a great brain. But
No.
actually, if I can switch all that noise off in my head and think,
Yeah.
do you know what? The flowers are coming out, the sun
Yeah.
is shining. I've
Yeah.
got three healthy children and a husband who loves me. I'm really lucky and focus on really small, narrow things
Mm.
because otherwise, like, you get
It's
too worried
short.
about what's going on in the news or what someone said about you on social media or what you're
Right.
going to cook for supper or what all this stuff, and
Yeah.
can be catastrophic.
Yeah.
And the other thing I learned from a family friend ages ago was you can only do one thing at a time. So, like here now, I'm doing this podcast with you, Heather. There's no point me worrying about 1,001 things that I have to do and how I'm not going to get them done because they're still going to be there after the
Yeah.
podcast.
Right.
So,
Right.
why don't
Right.
I enjoy the moment? Because if you live in the present, that's you'll never get that time again. And you only regret not doing something rather than doing something. So, I
Yeah.
really try as I get older to just focus on the here and now
Yeah.
because otherwise you just get overwhelmed too quickly and then all the mindfulness, all the meditation, anything that you want to do is never going to happen.
It's never going to happen. I know. I agree. And, I kind of want to now talk a little bit about, or maybe just pivot because, I will say, and I opened with talking about this and saying, I talk a lot about HRT on social media, also because I think that's where, certainly when I started my platform, there's still myths and misconceptions.
Mm.
Don't get me wrong, 7 years later, but that was where the most myths and misconceptions were. And, we're mentioning the fact that there is still an immense physiologic shift that's happening in our body. So let's just kind of talk about like what are the things that hormones, do or responsible for and how our body changes after because I do think um I don't know, I see a lot of women struggling and sometimes I will take the approach if they're good candidates for starting them on HRT first. Then they start to feel better and then they can much more easily incorporate movement and good
Mm.
diet and these practices because they actually feel better.
Yeah.
You can't actually meditate your way out of a low estrogen state. What do you think about that? What's your
I
take?
totally agree. I had someone recently talking on someone's podcast and saying that if women live really healthily, have really good diet and exercise, their menopause symptoms will be very minor and they can just float through the menopause. And I was listening to that really cross because actually it's very patronizing to women.
Yes.
But actually, even personally, when I started to experience symptoms 8 years ago, I was doing yoga practice regularly. Don't eat processed foods. I've already said I don't drink alcohol. My lifestyle was really good. Yeah, I had muscle and joint pains, like fatigue, like you wouldn't believe. My migraines were just triggered all the time. I was putting on weight. I had this belly that I'd never had before. And I hated my life. I just couldn't sleep. I hated my husband. My children were no fun. And my memory was terrible.
Yeah.
If I'd come to see you as my doctor, Heather, and you said to me, right, Louise, you need to up your because it's my hormonal imbalance. And in medicine, we get taught you treat the underlying cause, you assess the patient clinically, you work out what's right for them as an individual. And the most frustrating thing, I suppose, about me is when I had worked out it was a hormonal imbalance. The only thing that was offered, or I didn't even go to my GP because my friends have been there enough, and they were just giving out citalopram and venlafaxine, which obviously are antidepressants, and I wasn't depressed. So I had to go and see someone else and get hormones, but that was my choice. If I didn't want hormones, I wouldn't go and see a menopause specialist. I would go and try and something else. But we have to remember that our hormones are biologically active. They're not just there affecting one small area of our brain that causes flushes and sweats, which many people lead us to believe. They actually work on every single cell in our body. And, I've got a pathology degree. I spent a whole year thinking and being taught about our inflammatory cells. And when they're primed well with good conditions, they're anti-inflammatory in our body. But what's really interesting is when they're primed badly, they become pro-inflammatory. So they don't become neutral. They actually go against us and increase inflammation in our body. They work, especially our monocytes and our macrophages, and they produce all these chemicals, these cytokines. They genetically change how our cells work. They affect the mitochondria. They affect every cell process. And one of the things that causes this pro-inflammatory response is low estrogen, or having the estrogen that is produced in our fat cells. So there's so much talk as it's just a transition, we'll get through it. Yeah, your body adapts. Your body adapts to anything after a while, but your immune cells won't change. They'll still be inflammatory. And I think until people realize it's whether you have symptoms or not, our immune cells are they can change with estradiol, but also progesterone and testosterone. And we were talking before we started recording about menopause being a global health problem,
Yeah.
and looking at the inequality of care throughout different countries, and looking at the diseases that are affecting women, because many countries we're living longer, which is wonderful, but we're not living healthier for longer.
No.
And
Right.
a lot of it is due to inflammation, and poor diet, processed foods, again, primes these inflammatory cells to be pro-inflammatory. Smoking does, alcohol does. And it's not just the estrone in fat cells. Our adipocytes produce other cytokines, chemicals that will increase inflammation, affect the way our immune cells work. But I think when we've got a noise and like people who are not agreeing with things, let's just go back to the basic science. And I suppose my comfort blanket is going back to basic science and looking at basic physiology, how our cells work under normal hormonal situations, but also pathology. Because when our bodies change, that's the problem. And pathology, as many of you might know, is the study of disease. And I was very privileged to have great lecturers in that year. But it just sparked my mind and memory and my mind and my way of thinking in a very inquisitive 2-year-old, but why is it happening? Why is it happening? Like, it's not good enough to just be told this disease is this and your treatment is this.
Right.
And once you do that, it's very, very enlightening, I think.
Mm-hmm. I agree. I love the idea of just going back to the basic science, especially as, things get heated or there's controversies. Let's look at the science.
Mm.
Quite frankly, even sometimes science can be biased. But if you just go to a straight textbook, what is happening at the cellular level? What is happening to the way that hormones are affecting proteins, are affecting cytokines, are affecting all the little immune cells in our body? This is a really nice place to start to just kind of, make the drawing board clear and make it fair. Because I tell you this one story, and I'd love to know how you respond to it. But back in 2017, I was doing grand rounds on the safety of hormone therapy. So, 2017, let's go back in our minds. That's pre-pandemic. That's pre-TikTok. That's a lot more still. HRT is still it's kind of scary. And I gave this beautiful lecture to this large academic crowd. It was a grand rounds for all specialties. And this doctor stood up and said, well, Dr. Hirsch, women don't want HRT. Women don't ask about HRT. They don't want it. And I thought, well, they don't know because they've never been given the options to know the whole story. They've never been, they don't know that it's, they don't know what they don't know. They don't know that it's an option, even if they know that maybe
Mm.
it's, you
Yeah.
know, and I think that we both agree that what we really want is for women to have the whole story, looking at the science and making decisions about if they're going to, support lifestyle
Yeah,
and reap benefits from HRT.
I totally agree. I think it's it's the same with lots of things in life. For example, if I buy a car, I decide whether it's going to be a blue car or a red car or a white car or whatever color. I decide, I look at a few reviews, I decide, but then I get in it. I decide how fast I drive or how slowly I drive or where I go in it or who my passenger is or whatever. I'm
Mhm.
making those decisions. And I can tell you that we've both got different cars because we're in different countries and I'm sure we've got different cars. And that's fine. I'm not judging you because you've got a different color car to me. But we've both gone it with our own research that's relevant for us. And you're
Mhm.
absolutely right, Heather, because if you don't know the stories, if I didn't know that the car I bought was like the worst safety car in the world, because I didn't read that study, I would feel really cheated if I went to buy it just because I like the color and the
Right.
salesman was a nice man. And
Right.
this is what's happened with hormones. When I started my clinic, many years ago, and even as a GP, people come and say, look, I don't want hormones. What else can I do? I feel dreadful. And I'd spend the whole consultation saying, well, actually, hormones are a choice, and there are different types of hormones. And now this discussion is always based on the WHI, the Women's Health Initiative study. And many of your listeners will know it was based on synthetic hormones. Even the study, actually, the results from HRT were pretty good. But it's like comparing apples and pears and bananas and saying all apples are yellow because they're a fruit. Of course they're
Right.
not. They're just
Right.
different. And
Right.
so when you look at the hormones that are biochemically the same as our own hormones, and we know how safe they are, but also let's look about why women are taking it about osteoporosis. I've doctored enough women who have had osteoporosis of their spine. They've been in a lot of pain and discomfort with these microfractures in their spine. And I just have made a personal decision. I want to do everything I can to keep my bones strong, and that includes taking HRT. I am less worried about breast cancer risk, but actually, the type of HRT I take actually has been shown to have a lower risk of breast cancer from it
Right.
anyway. I know I've still got breasts, so I have a risk of breast cancer, whether I take HRT or not. So if I do develop breast cancer, which I have a 1 in 7 chance of, I'm not going to blame my. Actually, I know that I'm more likely to die from heart disease than I am dying from breast cancer or any other condition. And if I have an osteoporotic hip fracture, then my mortality, my death rate will be about 1 in 5 chance of dying within a year. If I'm diagnosed with breast cancer, my death rate will not be, 1 in 5 risk in a year. But I've read all the statistics. I've made an informed choice, and for me today, this is the decision I want to make. HRT in conjunction with lifestyle changes that I've made. But I'm not the same as my best friend. I'm not the same as a lot of my patients. And I feel so strongly that should make our choices based on proper evidence-based knowledge that we have available to us, not skewed data, not data that someone who's paid by a drug company is telling us, not somebody who's just got a little bit of clinical experience. Because
Mhm.
when we look in medicine, medicine is a science and an art. And I'm very scientific, you probably tell, I'm very black and white. But the art is individualizing care for patients. And that's the bit that's sometimes lost. So when I was a medical student in the 80s, it was all about a bit of art, really. We didn't really have evidence-based medicine. When David Sackett first talked about it in 94, we were like, what? What's that? And now it's gone the other way, that it's all evidence-based, as in you need a randomized control study or there's nothing else.
Yeah, or
But
you're a
actually, when I buy
terrible
my
doctor.
car, but when I buy my car, there's no randomized control
Controlled
study. There's not a
trial.
placebo who's doing my car and say, so we need to be more creative in what we do. But
Yeah.
there's so much misogyny, I'm afraid, and there is a lot of medical gaslighting. And these
Uh-huh.
words, I don't think I even knew what they were until I started doing menopause work. So I feel very outraged for the women who haven't got a voice, or they have got a voice, but the people they're seeing don't have ears and they're not treating them as individuals. And I think that is the craft of medicine, is being able to individualize care.
I could not agree more. I have had patients um at the brink of taking their lives. Doctors won't give them
Mm,
HRT. It's not approved for that. We don't think that it would help. I mean, this is ridiculous. This is ridiculous. This
mm,
is just not listening. This is stubbornness for stubborn's sake. This is either
mm,
insurance driven or fear based or malpractice based. And like, we are not taking care of women. They are not men. We're not small men. And, I couldn't agree more. I love this conversation. I think we've had such a good conversation about how menopause impacts us, the holistic approaches, the things that all women should be thinking about, and how we really want all women to have choices, the facts, and the ability to make the decision that best fits them.
absolutely. So thank you so much.
Thank you, Louise. I can't wait to talk with you again soon. Thank you guys so much for listening.
Sorry, do that bit again.
You got it. Let's see. Absolutely, Louise. Thank you so much. Thank you guys so much for listening. I can't wait to have you back on again. And we really appreciate all the change that you have led. And I can't wait to talk to you again soon. Bye, everyone.
Oh, thanks, Heather.